Hi, good afternoon. Emma from Amden Capital. So today Emma bersama Dr. Naren.
Yeah, Dr. Naren,
Yes.
I'm
So
the.
please introduce yourself
Okay.
a little bit.
My name is Narendran. I'm the resident concerned ophthalmologist and vitreoretinal surgeon here at Bukit Tinggi Medical Centre. Today, I've been given an opportunity to share some of my thoughts about cataracts and the causes for cataracts and what are the options of treatment and all that. So, Emma, what would you like to know about cataracts?
You said the golden words cataract. So actually, what is cataract, doctor?
Okay, see, like how a camera has a lens to help you focus to get a clear picture.
Mhm.
For the in the eye also, we have a clear lens which helps us to focus.
Okay.
Okay, so when you look at the anatomy of the eye,
Mhm.
this is the front part of the eye, and this white thing here is the lens, which is a natural clear lens. So
Okay.
when we're young, the lens is very clear, like a clear glass. You can see through clearly. But as you get older, or if there is any reason for it to turn cloudy,
Mhm.
that means it becomes opaque, like a bathroom window, the
Yeah,
glass,
yeah.
white. So it becomes
Mhm.
like that. That we term as cataract. Of course, the
Mhm.
causes can be many,
Okay.
but the most common cause is aging. Okay, it's a
Aging.
cataract. Most of the
Okay.
time, it's an aging process.
Mhm.
As you get older, the clear lens becomes cloudy. Okay,
Okay.
and when there will definitely be a reduce in your vision. Okay, so it is
Okay.
what we call as it is reversible blindness. So you see, in
Mm.
blindness, you can have non-reversible and reversible.
Okay.
Non-reversible can be because of many other. You can have an injury. You can have some disease process which can cause blindness,
Mhm.
which cannot be treated. But you have something blindness caused by cataract.
Mhm.
It's a reversible blindness, and it's a number one cause of reversible blindness in the world.
Cataract.
Yes,
Oh, so it can cause reversible blindness.
yes, because it means it can cause blindness,
Yes.
which can be reversed when you do
Mm.
surgery.
So it can be corrected
It can
by
be surgery. It
surgery.
can be corrected by surgery.
Mm.
And unfortunately, if you look at it in society as such, many people are still not aware that you can have surgery for cataract. You might think we have progressed medically, we have progressed with the advent of internet
Mhm.
and information technology and all that. But there are still many people who are ignorant of the fact that they have poor vision, which can be treated.
Okay. So when you say it caused by aging, normally around what age that we might need to understand that I might have to get the eye check?
See, most of the time we look at it from the fifth decade, that means 50 onwards.
Mm-hmm.
But for whatever reason, sometimes for some people it can start much earlier.
Okay.
Okay, just to let you know, there are some children who are actually born with cataract.
Oh, how
Yeah,
to detect that then?
no, that one normally if you go for an ultrasound screening with your
Okay.
gynecologist,
All right.
who are very good with the ultrasound scanning and all that,
Mm-hmm.
even when they do the ultrasound, they're able to pick up cataracts in developing babies. And they will inform the
Oh.
parents that possibly your child could be developing a cataract. So if when the child is born,
Mm-hmm.
best to get an eye assessment, because if the child is born with cataract,
Mm-hmm.
there are doctors who can do surgeries to these newborn babies to remove the cataract.
I see. Okay,
You know.
but that is not a normal case or
Now, there is
standard.
what I'm saying is, if you ask an
Mm.
age when cataract will develop, like I said,
Yes.
normal thing is 50 years onwards,
Yes.
but it can start from the time you're born also.
Mm-hmm.
So
Mm-hmm.
it's like that. You see.
Oh.
So but 50 from the fifth decade, from 50 onwards, I would advise you to get an eye assessment.
Mm-hmm.
But the way I always tell my patients, they say life begins at 40. So
Yeah.
all problems in life
Okay.
begins at 40. So better go for an annual assessment to see whether you have any issues now.
Yeah. So, okay.
You know.
Okay. So actually causes of a cataract selain daripada aging is what,
Okay.
doctor?
Other than aging, of course,
Hmm.
if you have any disease like diabetes,
Okay.
okay, in some cases glaucoma,
Okay.
okay,
Mm-hmm.
because some of the drops that you use for glaucoma can induce cataract, okay,
Oh,
and then
okay.
if you have any medical problems which you require steroid treatment, like
Okay.
if you have skin disease, you have arthritis,
Mm-hmm.
or you have any disease which requires steroid treatment, you
Mm-hmm.
can develop cataract. So we
Okay.
call that as medication-induced cataracts. Or if you develop an injury to the eye,
Mm-hmm.
we call that as a traumatic cataract.
Mm-hmm.
If you get an injury, you can get traumatic cataract. So these are the common causes for cataract development: disease, medication, injury.
Okay.
And if you have a family history, a strong family history of developing cataract early,
Okay.
that also can induce
So it also can mean that it could be genetic.
in a way, yes, genetic. That means because not all families, but certain families have very strong
Yeah.
history of developing cataract much earlier at a
Mhm.
younger age. Then, of course, it's a very rare thing, but it can happen too.
It can happen. So what are the actually signs or symptoms?
Okay,
So for me
I
to
mean,
understand, oh, I might have cataract.
okay.
So what's
See,
that?
most of the time when I say much in the fifth decade and sixth decade, usually they have a
Yeah.
difficulty of reading papers or looking at TV. They have a little bit of disturbance, or
Mhm.
looking at wearing clothes. They don't get the color, especially ladies when they want to choose colors
Yeah.
to wear. The colors don't come up to them. The colors don't look bright, don't look vibrant. Looks a very dull color. The red might not look very vibrant red, might look like a dull red. The yellow might be very dim, so you will have a color contrast problem. Then night driving will become an issue. You'll have a problem of glare, halos looking at lights. You can't see the signboard clearly. You can't see the car number plate in front. Okay. Then when you're watching TV, you're not able to see the the translation, the letters there,
Yeah.
or you can't see the images
The
clearly.
subtitle.
Subtitles, yes.
Because normally, suppose your eyesight are very good, suddenly you
You develop these
more
problems, and then
difficulties.
you have these difficulties, and then sometimes your friend says hi to you and you don't notice your friend, you don't remember dia sombong. Orang ni sombong.
Actually tak nampak.
Tak nampak.
Semakin tak nampak.
Orang ingat sombong.
Sombong kan.
Ah,
Okay.
So these are the few things. So when you have these problems, I'll advise you to go and see the nearest eye doctor. But if there's no near eye doctor, at least go to an optical shop to get yourself assessed. Because nowadays the optometrists, they're quite well trained to pick up to see whether your vision is down because of glasses, needing for glasses, or something else is causing. Because I do get a lot of patients who come to me saying that they've gone to the optical shop and they have been advised to see the eye doctor because it's not the glasses power that is causing the problem.
Interesting.
You know?
All right.
You know?
How about cataracts? There are many types, or how?
Okay, many times in sense, see, like what you said is a lens has got a front part we call as anterior capsule, has got a back portion which is called as a posterior capsule, and then is at the center it's called a seed which is called as a nucleus. Okay, nucleus, and surrounding the nucleus you have what is called as the cortex. Okay, so you can develop an anterior subcapsular. That means below the capsule you can develop a cataract.
Okay.
You can develop a posterior subcapsular. That means in front of the lens, the capsule you can develop a cataract, or you can develop a cataract in the nucleus. It's called as a nuclear cataract.
Wow.
Yeah.
So many types of cataracts.
No, I mean we try to make it sound complicated, but
Actually,
the thing is each type of cataract will cause a different kind of a symptom.
okay.
So that only it doesn't matter to you because whatever type of cataract you come and see the doctor, the option is going to be a surgical option. But the thing is, when you ask how many types of cataract there are, but for the common man, I will say that a cataract most of the time is a nucleus. The central part gets opaque. To keep it simple.
Okay. How about if the cataract surgery? How long the process to recover?
Okay, most of the time nowadays the technology has improved so much that I think a week to 10 days, a week you can go back to work.
Oh, okay.
That is if you're doing office work. But if you're working in a construction industry or a paper or in an industry where there's a lot of dust environment and all that, I will say at least take off for 2 weeks.
Okay.
But if not, if you're a clean environment, I think within a week you can get back to work.
So 1 to 2 weeks.
Yeah, just to let you know, my dad, I operated. Next day he went back to work. Not a good patient, was he?
Because he has you.
So I mean, in the sense that you're quite comfortable, you can get back to work. I would say within a week.
Okay.
Within a week, you can get back to work.
Week.
Yeah.
All right. Interesting.